In the news today, the rising cost of medical coverage has insurers, providers, and patients looking to preventative healthcare models.
This program and other programs that Healthy Hoops runs have helped save her life. She was hospitalized 48 times last year because of Healthy Hoops. She has not been hospitalized once this year.
Every healthcare organization is faced with disease states that disproportionately affect its membership, whether it's asthma, cardiovascular disease, or obesity. The Healthy Hoops program is the solution to your members' health management needs.
The vision of Healthy Hoops was to reach out to a community that is growing in the Philadelphia area, in fact nationwide, and that's youngsters with asthma. And the goal is to give them an opportunity to learn about their disease, to learn how to cope with that disease, and to understand, along with their parents, how good nutrition, getting their sleep, staying on top of the disease through medications will enable them to participate in all aspects of life.
This NCQA-recognized program for children and their families uses basketball as a platform to teach disease management. Improved health outcomes means decreased utilization and cost for healthcare organizations.
Not doing this is bad for business. Sicker people are more expensive to take care of.
You may need more medication, okay?
The Healthy Hoops program was developed to address the growing number of school-aged children with asthma. According to the Centers for Disease Control, nationally, an estimated 9 million children are affected with asthma.
Over 10% of the youngsters in our community have asthma, and many of them don't know that they have asthma, or their asthma is not under control. Therefore, they have to go to the hospital, the emergency room, they get admitted to the hospital, and this is just an ongoing problem for youngsters who have asthma.
And it's not hard to get asthma under control if you learn what your asthma is like, and what you need to do to control it by taking medicines and avoiding triggers in your environment. And that's what the Healthy Hoops program is all about. It's about providing people with the health information and the education to understand their asthma and understand what they need to do and can do to control it.
Understanding that exercise, nutrition, and monitored recreational activities are among the safest and most effective methods of controlling the efforts of asthma, the program targets children ages 7 through 15.
What the Healthy Hoops program does is it encourages the parents and the children to get involved with us, and we use basketball as sort of the enticer or the hook to get these children and parents to come. We have some of the best coaches in the area working with us, and at the same time they learn how to control their asthma through athletics.
One of the things that it does, it brings about awareness of the asthma problems. So it gives us a chance to make contact with different communities, different neighborhoods, and give them information about what are the triggering mechanisms. What are the things that you need to know when the asthma is getting ready to affect you, not only that young person, but that parent?
I think for Sean, when he's on a team, a lot of the kids do not have asthma. He's the only one that has asthma. The main part of Healthy Hoops is not only education, but it helped him to be included with other kids. When he was around all these other kids that had asthma, he felt more inclusive instead of excluded.
I found out more information about asthma than I ever had in the last 10 years.
We shouldn't really overexert ourselves and take our puffs before we do certain activities. And if we get to the point where we can't breathe or whatever, then we stop and then take a break for a while and then come back and rejoin the group.
My husband and I actually have kids on both sides. We have asthmatics as well as overweight children here. And I think that is an excellent program because our children so often get lost in the shuffle.
Healthy Hoops uses a holistic approach to improving the quality of life and health care by educating the entire family on the importance of appropriate medication use, treatment compliance, and monitored physical activity, and by providing clinical screenings and individualized medical expertise.
There's a clinical aspect to this program. The basketball's fun, they learn a lot about it, but we want to screen them. So we need the doctors and nurses to come in to run the screenings, to understand how severe their asthma is.
The individualized care has been proven to increase treatment compliance and health outcomes while decreasing utilization costs.
We need more programs that's going to not only just deal with the children, but deal with the entire family, because that way everybody can get involved. And it's not just having one person who may have asthma, but it's teaching everybody in that family how to deal with asthma, how to help their loved one that may need it, and it also teaches all of them how to do healthy tips and everything that we do.
The Healthy Hoops program really fits with AstraZeneca's mission, and that is to really get involved with community healthcare needs.
The Healthy Hoops customizable program template consists of 3 primary elements for success, including coalition building between private organizations, the public sector, community groups, and healthcare experts. A professional development asthma education series created by nationally recognized educators. Management of events for participant registration and program conclusion, which feature health screenings, basketball drills conducted by professional basketball coaches, family education, and a participant's reward day to celebrate their asthma management progress.
I've been involved in asthma care for the last 25 years, and the Healthy Hoops program is a great program in terms of teaching the kids about asthma, screening children to try and find out those that have asthma and those that don't have it under control, and even developing action plans so that these children can better take care of their asthma on a long-term basis.
Based on the last 3 years of data, Healthy Hoops asthma interventions are attributed to improvements in the quality of life of participants and have reduced healthcare costs for plans' pediatric members by demonstrating decreases in ER visits, decreases in hospitalizations, reductions in weekly rescue medication use, increases in use of controller medicine, improvements in forced expiratory volume 1, decreases in nocturnal awakenings, increases parental knowledge about asthma triggers. A member snapshot taken over a 3-year implementation period further illustrates organizational savings. A Keystone Mercy member, age 10, diagnosed with asthma, enrolled in Healthy Hoops in 2004. The comparison of utilization from 2003 to 2006 shows ER and inpatient admission costs decreased by $31,202.
I got blown away when I saw the numbers. I mean, the changes in the ER visits, the changes in the hospitalizations is something that I had never, ever seen before in any kind of disease management program that we've done. This is what it's about. It's about saving lives.
Building upon the core components of the Healthy Hoops program, the implementation team can customize the program to fit your organization's goals and your members' unique healthcare needs.
The goal was to teach kids about basketball, but more importantly, to teach them about their asthma, how to manage their asthma, how to stay healthy and participate in sports or dance or any other activity.
Make a 3-point play to improve members' quality of life, enhance your brand and community presence, and control asthma healthcare costs. Contact us today to bring the Healthy Hoops program to your community.